Innovative content. Global audience.
Taking care of their patients as safety, others are not. Upward of 250,000 people die every year from preventable errors in the hospitals. It's up to everyone to make sure that patient safety is the number one priority at every hospital across Nigeria. Even though some hospitals have hidden dangers, there are things you can do to protect yourself and your loved ones. So today on your favorite program, Our Health, it is all about patient safety. Like that saying that health is wealth. And you know how we do it here on Our Health. We talk about your health, my health, and our health. Of course, when you say, sometimes people say health is expensive. So sometimes you try being sick. And so today, when we talk about patient safety, we're talking about how hospital, pharmaceuticals, and other healthcare organizations protect their patient from errors, injuries, accidents, and of course, infections or things that could lead to these infections. And so today with me here live on the show, I have with me Farm Omini James. He is going to tell us, of course, I'm not a health professional. That is why I have him here on the show with me. He's going to tell us more about a patient safety. What are the things we are supposed to do, the things we are not supposed to do? You're welcome to the show, Farm. How are you doing this morning?
I'm fine. Thank you for having me.
You're welcome. So to a layman, what is patient safety?
Thank you. If we're talking about patient safety,
Mm-hmm.
then we are talking about the absence of preventable harm
Okay.
that um, a patient can have during the process of healthcare. Then you're talking about those things that can be prevented, particularly the for the patient to be safe
Okay.
while getting healthcare
Okay.
delivery.
Okay.
So there are so many of them,
Okay.
but to mention but a few, we were talking about patient safety. First, we talk about the environment.
Okay.
Yeah, because the environment where the patient come to get healthcare,
Services.
if it's not properly kept, then definitely they bound to get so many. In fact, you even have to accumulate other diseases and infections
While trying to
yeah,
treat one, thereby
So
getting more,
more
receiving more
infections.
infections.
Exactly. So the environment should be properly kept clean at all time, and it shouldn't be in a way that it pose threat to your patient.
Okay.
Your environment, and then another.
And sometimes too, when we talk about patient safety now, are we just looking at the hospital, or is something that is beyond the hospital?
Yes, it's beyond the hospital in the sense that if we're talking about hospital, then the question should be how many people go to the hospital.
Now, when we talk about hospitals, when we talk about pharmaceutical shops, or we talk about other healthcare facilities, are we just talking about patient safety within the confine of this health sector, around here, or when they go home, things they can do for their own safety as well, or just within the eyes of their pharmacist or the doctor or the nurses?
No, it shouldn't be narrow to just the
Okay.
health practitioners.
Okay.
It's also including what they practice at home.
At home.
Yeah.
Okay.
The safety measures the patients can go to prevent
Okay.
those diseases and then getting themselves involved in dangers or in the name of getting health care and services. Because some patients, mostly you can give them prescription and they go home to do otherwise.
Okay,
Maybe
that is
because
true.
of non-attentive to the prescription when
Yes.
you were giving the prescription.
That is true.
And otherwise, maybe another person can also abuse the drug, not in the sense of maybe they don't know, probably in children and others. So those kind of measures, like if the abuse shouldn't be there, if the drugs that the patient got from the pharmacy or from anywhere is properly kept, so they wouldn't get such incidents.
Now, okay, when we talk about the safety of patient now, What are some of the steps? I know you did mention, you talked about environment. What are some other steps patients could follow? Because a lot of people tend to feel like, okay, like I did mention in the beginning of my show, why a lot of hospitals are take care of, they are careful about the safety of their patient. Others are not. I've been to hospitals where I told my mom that if this is the last hospital, I'm not getting the treatment. I'm going home, because you just go there, you want to throw up. The place is so unkept. So if the rooms, the beds are so unkept, let's not even go into maybe their toilet, your private restrooms. What could happen? And then this is a place people are coming, like you rightly said, to get well. And then at the end of the day, you find out that a lot of things are not properly kept. The place is not well cleaned, and sometimes that is why people perceive in hospital here. You go to so many hospitals here in Nigeria. You go and the odor, the smell is horrible, whereby you have things you could use to clean, and that is why they should have cleaner. And I know hospitals, pharmaceutical shop do have cleaners that come, because patients could just come and throw up.
To
Yes,
prevent such or odors and offensive smells from
yes.
coming.
So what are other measures that can be taken? Because you did mention environment. So what are some other ones?
Yeah, you talk about attention. Yeah, in the part of the person delivering the health
Service.
services.
Okay.
If there is no proper communication and attention during the delivery, then there's bound to be contradictory processes. Like if I'm telling you that this is what you're supposed to do and you're not listening very well, your mind is not where we're talking about it, then there's this possibility for you to go and do otherwise. So there should be a proper communication between the patient and the health care delivery, and
Okay.
then also in terms of prescription. Because if you are prescribing drugs to somebody, the person should probably get it. And if you don't know what you're talking about, you should always ask questions so that you can break the synergy between the patient and then
Provider.
the prescribers.
Now, when we talk about hand washing, for instance, how important is this when we talk about hand? Because I noticed that it's during, okay, maybe when we had COVID-19, Ebola, you see people rushing to wash hand, and these things are no longer there. And of course, you see patients also. I've seen patients, people who are not feeling well, they've been holding money, they hold money in one hand, very dirty naira note. They peel the drugs, pull to that same hand and take it. How dangerous is this? People no longer even take washing of hand, cleaning of the environment or hands before taking medication or eating to cognizance.
This is associated with people practically, because if you're talking about personal hygiene, this is what you learned from your nursery school, your primary school, your junior secondary school. You were taught about personal hygiene. So it's very important that you wash your hand regularly before you handle anything that has to go through
But
your
do you
body
people
system.
now, you as a pharmacist, you do administer medication drugs to people. Are you at have you at any point in time trying to tell your patient this is what you have to do before you take your medication, or you just allow them to go?
Definitely, you have to tell them what to do before
Okay.
they take their drug. Yes, you won't want to give somebody a drug and then tell the person to go without telling the person that you must eat very well for you to take your drug. And the process of
That
it,
is
you
the
have
one
to
that
wash
is
your hand.
that
Yeah,
is that
yeah,
is what is familiar with the
yeah.
Nigerian health practitioners.
You have to
Eat
eat
well, that is all, and maybe sleep well after eating, later
and have
rest.
enough rest. Yeah, but
But when we talk about some of these safety measures now, talking about washing of hand and doing other things, and let's even leave the patients now. You, the providers, I've been in a place where a pharmacist will come. There was emergency, some kind of cuts. There's blood spilled all over the places, and he just come clean and treat without washing the hands properly. A lot of pharmacies, a lot of healthcare providers, they do this. Why?
oh, for the I think I wouldn't say because I'm not there, but what is obtainable before you
Is
can
wearing
actually
hand
handle a
gloves.
patient in bleeding, you must have your hand glove.
Hand gloves.
Yeah,
Okay.
and which after is not just having the hand glove. Now, when you are done with your treatment, you afterwards comes back to you remove it and then you wash your hand, which is obtainable. So that is what we do.
And also, when we talk about healthcare services here, and then we talk about the safety of the patient, because I am more focused today about what the patient get from the organization, the health. It could be the pharmaceutical shop, it could be the hospital, or any health care organization. Now, who is in charge? Who is supposed to see that those patients are well kept, the place is neat, everything is okay with them?
It's a general thing.
Okay.
Yeah. If you're coming to a pharmacy or a hospital, I know the first people you meet, maybe some hospital, you meet a receptionist that will direct you to places to go to, and it doesn't end there. Because if you are coming for consultation, then I should be able to tell you what you should do to be safe. Like you actually told me your problem, and then you are looking for solution. So you should be able to get that possible solution from you by telling you what you should do and what you shouldn't do.
Okay.
So it shouldn't be for just a particular person, or maybe you hire somebody different that will come and stay in the hospital that will enlighten people on personal hygiene and all that. I think as the doctor or any medical practitioner is giving you prescription or telling you what to do, they should also tell you the health measures or the proper measures in which you should be able to keep yourself safe from disease and then harm.
Then we've seen also in Nigeria here, a lot of hospitals, they don't have, like you mentioned, not just cleaning the place, but using, you said, well, what is disinfectant? A lot of people don't have this. Are we supposed to be living in environments or have hospitals where, because people come to the hospital because they are ill, they could just throw up on the floor, they could do anything because they are not feeling well, and it's something that is beyond their control. And a lot of people don't have this thing around to clean or to do whatever it is to keep the place neat.
If they don't have it, that means it's just negligent, because it's something that you have it all around, not just market. In fact, you have major distributors coming to hospitals and pharmacy to bring their products for them to buy. Most of the disinfectant, most of the reps goes to the hospitals and pharmacies to sell their product, those disinfectant products. And so if you're not buying it, if you don't want to buy, that means you're just practically that means you don't want to practice what is wise.
But fam, is there any bodies or maybe bodies, organization, or people in charge of seeing to these things or monitoring that every hospital, every pharmaceutical shop have all these things and they live up to standard in taking care of their patients?
There are many of them.
How functional are they?
They do. You have the environmental. The environmental comes time to time.
Okay.
Yeah. You have the NAVDAC.
Okay.
That comes time to time.
Okay.
You have also pharmaceutical council that moves around on routine check to ensure that what is obtainable is practiced. And if you don't, if it is not what you're supposed to do, that is what you're doing, your shop will be locked up.
Okay.
Yeah, and then you go to sell.
But fam, let's be serious. We hardly see pharmaceutical shops or hospitals in Nigeria being locked up.
Yeah.
No, I've not seen.
There are many of them.
Really?
Yes.
I've not seen, because I've seen that
if you follow them when they are on check, like if they find out that what you are doing is not what you're supposed to be doing, you're having a particular product that's endangering people and you're not handling the way you're supposed to handle them.
Okay.
Your shop will be locked.
Okay.
For that moment, you'll be restricted from sales until you're able to get the proper way, and then you practice it the way it's supposed before you can be given back your license to practice the same way it's supposed.
Because we know that here in Nigeria as well, a lot of people, a lot of patients also are difficult when it comes to adhering to instructions from medical professionals. I know we live in a country where people just feel, okay, I'm well now, I have headache, I have fever, I'm stronger now. Maybe they just took 2 doses from the whole medication and they discard the rest. They don't want to take that. Sometimes they don't care, even when doctors say wash your hands before touching uh, anything like your medicine. People don't care. They just feel like disease not a kill African man. That is a phrase we're used to hear in the parts of the world. Now, what are some of the challenges you people go through when we talk about patient safety?
If you, just like you mentioned, that is where the issue of drug abuse comes in.
Okay.
Like a patient come and then after getting drug, they don't take their drugs the way they're supposed to take it.
Okay.
Yeah, most of them take a little drug,
Okay.
and then maybe when they feel they are okay, they stop taking the drug. We are supposed to complete the dosage of the drug so that
Okay.
the drug would work effectively the way it's
Okay.
supposed.
Okay.
Then at that moment or at that time, if you don't take your drug religiously, then you're bound to have resistance to some of the, especially in antibiotics.
Okay.
Your body becomes resistant to some of them, and which is not
Healthy and
yeah, it's
good.
not healthy, it's not good at all. So the advice is for it to be okay, or you need to be properly.
Anyway, hold that thought. Fam, we'll be right back. Our viewers, this is our health, of course, where we bring you issues that borders on your health, my health, and our wealth. Of course, my health and our health. You know that saying that health is wealth, so we have to take cognizance of everything that has to do with our health, and of course, us as a people. Now, don't go anywhere. I'll go on a quick break, and when we return, our health will continue. Stay with us. We'll be right back after this break.
Hooray! It's Nigeria Week London 2023. This is a celebration of Nigerian foods, film, arts, culture, fashion, music, dance, and comedy. Also, there will be a comprehensive economic summit, exhibition of Nigerian organic agricultural produce, and a meritorious recognition performance awards to deserving Nigerians and industry icons. Nigeria Week will showcase Afrobeat A-list artists, Ice Prince, Terry G, Orishefemi, Oris Wileke, Konga, Bigiano, Nice Flow, Jetplay, and many more. Dates: 17th to 23rd July 2023. Time 10 a.m. to 11 p.m. daily. Venue: Lighthouse Theatre, 262 to 274 Camberwell Road, London SE50AY. Tickets available on Eventbrite at www.eventbrite.com/Nigeria Week or numbers below. For more details, visit our website www.superiorradioandtelevision.com. Nigeria Week, produced by SRTV in partnership with the Federal Ministry of Information.
Okay, my people, it cannot be better than this. The Nigerian Week in London 2023 got you covered to the extent that you can get a free ticket to the event. And this is all you need to do. Go to the Google Play Store and download.
Back from that quick break, this is our health, where we'll talk about your health, my health, and our health. And I have with me here Fam James, yet dissecting, and today's topic is patient safety. Like you do know that different hospitals, a lot of hospitals are out there, while some are very cognizant about their patient safety, not just treating them to get well, but the safety moving forward, while others are not like that. They just treat you anyhow, and they don't mind the environment, they don't mind any other thing. Now, you were just talking about some of the challenges you go through as healthcare providers in making sure that patients, their safety is a top priority, a top notch. What are some of the challenges?
The major ones, which is popular, is drug abuse.
Okay.
Yeah, most patient abuse drugs instead of not taking the normal dose they're supposed to take,
Okay.
or abandoning the drug maybe when they feel they are better. Thereafter,
Okay.
in a few time, they come back for the same illness, and then
Okay.
when you're coming back, it becomes double of what you would have.
Or maybe resistant to that
Yeah,
particular
exactly.
brand.
So you have to go extra mile to get other ones to make it work. And then when they go back, they still don't take the drug religiously the way it's supposed. And again, you see in our society today, many people don't really have money to go for health care facilities.
Okay.
That is very important. It's a very big challenge. It's like many people in the villages, you go to a pharmacy, you go to hospital, see people with 500 naira to get malaria drug and
Typhoid.
So, and the issue there, they don't run tests to know what exactly
They
is
just
coming. Then when they
guess, it's
feel
a guesswork.
feverish,
Yes,
exactly when they feel feverish, they feel that they
it's
have malaria
malaria.
and typhoid.
It's
So they
peculiar
want to
with
get
every Nigerian.
so they have malaria and they have typhoid, and then you come with 500 naira, which presently I don't think the lowest malaria drug you can get, the cheapest mostly now is from 600 or 700 above. That is the
Is that
estimate.
even the full
That
dose?
let's say at least
Okay,
that's the
something that could
lowest.
help.
Yeah, just to help for a while. That's just for the malaria drug. We're not talking about the other drug, maybe the typhoid and all that. So it becomes a very big challenges,
Challenge.
and then I think that's where our government, if let me just put in
Yeah.
quotes, the government should come in, so we have a free
Healthcare
healthcare delivery where
delivery.
people of such nature can actually go and get treated. But you see some minor cases of malaria, you see people dying just malaria and they're not something serious, but because they don't have the money to treat them. So it's a very big challenge to us and others.
All right, now when we talk about these safety measures or patient safety, now what are some of the importance? Why should people abide by the rules?
Very importantly, the first one is if you're talking about safety, you're talking about your life. Yeah, you have to save life, and it won't be good that you're coming to help your life and then in the expense of it you're endangering your life. So it helps to keep life safe, to prevent harm, danger, and then it make you to stay in your rights.
And maybe
So
infectious too,
yes,
because
prevention of infections. Yeah,
because we know that in the hospitals, infections flies left and right.
exactly.
That is the make
Yeah,
believe.
I even forgot to talk about the in diagnosis.
Okay.
When you go to lab, if the proper measure is not taken, maybe if the specimen were not properly labeled, it can
Okay.
actually give somebody different result of
Okay.
what is not wrong with, which we see in
We
several
see,
occasions.
but I've only
So
seen that in the movies. It's peculiar in our movies.
when you watch movies, they tell you the story that happened in real life. So it's not just movies. Yeah,
Okay.
it happened in real life. Like yeah, change of specimen, and then maybe after the lab, you bring a result of a different person for what is wrong with what is not happening to the person. So these are where the caution has to come in. In diagnosis, they should have a proper way of labeling the specimen so that they don't contradict other people's result. Mm.
And also, when we talk about how do patients and healthcare providers keep improving when we talk about patient safety, because we live in a country where people are stubborn. We already know that. Nigerians, I feel like it's only when they're at that point when they are really, really critically ill that they listen. But sometimes when we're working, we feel like, okay, I'm still strong. They tend not to abide by the rules. Now, how do we keep improving on the safety of patients?
I think this where I come in, where the social media, because if you talk about social
Awareness.
media and
Okay.
creating of awareness now,
Okay.
it's very paramount because
Okay.
you don't restrict it just to medical practitioners.
Okay.
I remember at the time when you talk about HIV and AIDS, like it's just like a ringing tone in everybody's ear. If you tune on your television, they're talking about HIV. It's in on radio set talking about it. Anywhere you go, you see posters of HIV
Billboards and
everywhere.
everywhere,
Then
yes.
people go sensitizing people about it around. That is from government,
Okay.
but you see as and then people were very scared.
Okay.
Then the level of unprotected sex as of then was very minimal.
Okay.
Yeah, but since the sensitization is not as it was in the past,
Past.
then people now relax and feel that those things are just normal.
That
You
is true.
get. So the media and then there should be proper sensitization from all angles to sensitize people on their safety. It's not. It shouldn't just be limited to health practitioners alone. I think it will
Okay,
go a long way to.
okay. Viewers will still here on our health, where we discuss about our health and things bordering on us, everything that has to do with our health. Now, don't go anywhere. I'll be right back after this break. Stay with us.
Hooray! It's Nigeria Week London 2023. This is a celebration of Nigerian foods, film, arts, culture, fashion, music, dance, and comedy. Also, there will be a comprehensive economic summit, exhibition of Nigerian organic agricultural produce, and a meritorious recognition performance awards to deserving Nigerians and industry icons. Nigeria Week will showcase Afrobeat A-list artists, Ice Prince, Terry G, Orishefemi, Oris Wileke, Konga, Bigiano, Nice Flow, Jetplay, and many more. Dates 17th to 23rd July 2023. Time 10 a.m. to 11 p.m. daily. Venue Lighthouse Theatre, 262 to 274 Camberwell Road, London SE50AY. Tickets available on Eventbrite at www.eventbrite.com/Nigeria Week or numbers below. For more details, visit our website www.superiorradioandtelevision.com. Nigeria Week, produced by SR TV.
Okay, my people, it cannot be better than this. The Nigerian Week in London 2023 got you covered to the extent that you can get a free ticket to the event. And this is all you need to do. Go to the Google Play Store and download TapTap app. Send as low as £1 to the account in Nigeria using SRTV as your transaction code. Screenshot your transaction and send to 447-459-513619 or email it to events@superiorradioandtelevision.com and the ticket will be sent to you ASAP. This is powered by SRTV London and TapTap Send. You already know what time it is. Your boy Ice Prince Amani. I can't wait to ride
Okay, it's so exciting. The game's been.
Hooray! It's Nigeria Week London 2023. This is a celebration of Nigerian foods, film, arts, culture, fashion, music, dance, and comedy. Also, there will be a comprehensive economic summit, exhibition of Nigerian organic agricultural produce, and a meritorious recognition performance awards.
Back from that quick break, this is our health, where we bring you issues concerning your health. I'm still here with Farm James. So I'm going to ask you, Farm, when we talk about you being a pharmacist, we see a lot of people at what point, what is an emergency that you can handle? Because I did recall that I had a friend of mine that was involved in a bike accident. So she called me, I drove down quickly, and we went to the hospital. She was bleeding, not really bleeding, scratches all over her legs. And at that point, they asked her to quickly go to the hospital. And I know that this pharmacist is quite big. They have doctors, they have pharmacists as well. So I feel I was angry because I felt this is like a mini, let's not say hospital per se, but the fact that you're wearing a doctor's coat. So I was thinking for her safety, you should find a way to stop the bleeding before you now send her away to the hospital. Now, at what point should we do that? Because they just felt like I felt like they didn't care about her safety at that point.
No, really, because if you talk about treatment, they always have a limit to what you can do,
Okay.
right? But not to withstand that. When you have issue, maybe accident, you can always help in a way to prevent.
Like first
Yeah,
aid.
first aid to give at least to prevent maybe tying bandage around to stop the bleeding to a minimum before you can refer the person to the proper channel where the person can be properly treated.
Now, talking about pain management, at that point when people are not, when they cannot, because we're still talking about safety of patient here now. So, talking about pain management, and the person probably is a little bit far away from a hospital, and you have a proper pharmaceutical shop around. What can you do before they can get to that hospital?
Just like I said earlier, it
Okay.
depends. We all have our work to do. We know where we specialize on.
Okay.
But just like as a farm or as a nurse, you have a general knowledge of something you can do to help a patient
Okay.
at a particular
Time.
Yeah. If it is a nurse, or if they have a nurse in the pharmacy that can handle sutures, maybe if the cut is very deep, that it needs to be sutured before the bleeding can stop. Then, but if not, what you can only do is just at that moment to try to arrest the bleeding,
Okay.
probably tying using cotton and bandages to tie it, and then
Okay.
before the person will go to the proper channel where he or she will be properly treated the way it deserves to be treated.
Okay, so it doesn't mean that, because I am talking about my friend, I'm using her as a case study, because her was just like a scratch, not like her legs were broken, or not like it was a very deep cut.
Another one, it depends on the people involved, or the
Okay.
people at that moment.
Okay.
Probably they didn't want to attend to it, or maybe because of the work they were doing at the moment. So, I think
Now, as a pharmacist, you people have right to even treat, or to maybe, like you said, give first aid. Let's start from there. Are you licensed to do that, or just to administer drugs?
sure, you have prescription.
Okay.
Yeah.
No,
So
like
with
what?
people's prescription,
Mm-hmm.
and let's just forget about the prescription, and then we'll talk about our health system in general.
Okay.
How many people go to doctor to get prescription before coming to the pharmacy?
Okay. So what do you people do in that
So
regard?
most people come to explaining their problems. So just being real here, not okay. Let's forget about the profession, what you're supposed to do as a pharmacist and what you're not supposed to do. But in general, if you're talking about pharmacy now, how many people comes with prescription?
I do go to the pharmacist with my
Just to tell them,
prescription,
is it
a
you want
doctor's
to-
prescription.
Okay, but
Yes.
that's for you, maybe because you have.
I go
access
to
doctor,
the lab,
but-
and then I see a
okay.
doctor, and then I go to the
There are many
pharmacist.
people, but many people don't.
Okay.
Yeah, many people don't go to lab. If you're talking about 80% don't go to lab.
Okay.
So they only come to explain their problem. I know our system. You some of them say when you ask them to go to lab, they'll complain of not having
the money, the economy as
lab.
well.
Yeah. So what do you do at that moment? You the person already explained how he or she feels, and you feel maybe you have fever. So what's the possible thing to give to a fever patient?
And fam, when we talk about the safety of patients, we are saying is unexpected harm, maybe during the provision of you giving the person or the health care now. So when we talk about our health sector, we talk about organization, healthcare organization, pharmaceutical hospitals, and then during this time of provision of treatment, how well should the patient be kept, and how should they be taken care of? We live in a country where nurses, people from the healthcare provider, sometimes they're angry with their patients for reasons I don't know. Sometimes they are not friendly. And don't forget also that there is this saying that when you are laughing, smiling with somebody that is not well, they tend to get well easily. But we now live in a country where people are harsh. Sometimes they are harsh for their own reasons, which I don't know. Now, when we talk about being friendly to your patient, making them happy, making them laugh, is it supposed to be a part of our patient safety as well?
Yeah, sure. I think it boils down to
Individuals.
the individuals, and then
Okay.
maybe the health caregivers not attaching their personal problem to their profession.
Okay.
Yeah. Because if we see somebody coming, maybe like a nurse or a farm or a doctor being harsh to their patient, maybe because of like maybe problem he's having, then it's transfer of aggression or something, but it's not supposed to be like, it's supposed to be as polite and friendly as you can to your patient, no matter what he does. Because at that moment, most of them don't even do it intentionally, maybe because of how they feel.
Okay.
So yeah, you try as much as you can to be friendly and
thereby helping them to ease the pain, the stress,
and all
and
that.
all
Because
that.
most people don't even want. Okay, maybe taking up injection. Some people can be funny.
I don't like that one either.
Some adults you even need
Be shouting to hold them,
and
be
if you're
petting
not
them.
patient, if you're not patient,
You just have to leave them there.
Sometimes you will leave them, not to administer the
Wow.
medication on them. but you just have to. But if you say that when you're just intentional with them, like you try to be calming to them, try to talk and be polite and all that, is to see at the end the person get the injection or whatever you want the person to get. So you just being patient with the
with the
patients.
patient.
Mm.
Now, just before we let you go, fam, how do you think how should people manage pain? Sometimes you see that people are in pain, and then you pharmacists, I know that is people that used to bear the whole bond because doctors will not give you more than the dose. Doctor will only give you the
Yeah.
said dose that, and I remember one time I had accident and doctor used to tell me that this medication is supposed to last from this hour to this hour. So if within this period, no matter how severe excruciating the pains are, they can't re-give me because that first one is already working, is still active. And now, but we live in a country where somebody could just walk, like you said, walk to a close by pharmacy shop and just begin to order. That is what I use. They order whatever they
What
want
they want.
and they take without prescription, without even pressing
Exactly.
saying,
They
take
just feel
this
that maybe they learned from their neighbor.
somewhere
Somebody have told them about the
about
drug
it.
that it's one, or maybe they watch in television
Mm.
that maybe an advert saying a drug that this drug work for this, so they just come to ask for drug, not knowing the dosage and all that.
Yes.
There's many people that
So how do
does
people
that.
manage pain? And sometimes, so don't forget that sometimes people could be in excruciating pains and then they don't have choice. They just come to you to give to them. How should they manage pains? Because doctors will only tell you within this said hour we can't re-give you another one, so you have to wait. And then people are in serious pains. Is it even right for them to retake that particular medicine to ease the pain, or they will have to wait until that time elapses?
Yeah, it hardly depends. It depends on the individuals.
Okay.
Maybe in children, if it is in children now, if you want to handle pains in them, then you should think about the measures, maybe physical measures they are that is favorable to them. Like maybe you want to give them injection or something, and then you give them toys, or you just play with them, try to
Okay.
just conversation with them, you try to make them feel
Take their
okay,
heart off
yeah,
that
bring them
whole.
out of it and
Okay.
all that, I think. And then maybe if it's a breastfeeding child, the mother can also be there to breastfeed the child before and
Okay.
after the medication.
Okay.
It helps to ease them the pains and all that. Then
Okay.
in adults, we have anesthetics that you
Okay.
can actually use to ease pains, and there is practical ways you can actually use to
Okay.
ease pain on them. And then they go on medication so that to help to calm their pains.
Wow. It's been so nice talking with you today, Farm James.
Thank you.
Thank you so much for being on the show today with us. Health issues are issues that if you sit here, you will have to keep talking. You have to keep talking. You can't even stop talking because the things, health issues are so broad. We have a lot of health issues here and there. But regardless, we still have to let you go today. Hopefully, we're going to have you back here with us again. But today, we've said quite a lot about patient safety. Now, what are some of the tips you as a person you want to leave behind for the viewers when we talk about patient safety?
Yeah. If you want to talk about the safety, my encouragement goes to everybody. It shouldn't be just the medical practitioners, but you should also adhere to your prescription,
Okay.
and you also listen very attentively when you are being when drug is being prescribed to you, and also try to take your medication religiously, and not just hospitals, also in your environment you should also try to keep it safe and
Okay.
clean at all time. Because if you go to some people's home, it's apology.
Even when you go to some hospitals, it's more
Exactly.
than
So
apology.
that's exactly what I'm saying. It shouldn't be only for the hospitals. The people should also keep the environment and their surroundings clean to avoid all this unnecessary harm.
Well, thank you so very much for being on the show today. Viewers,
Thank
we've
you for
heard from
having me.
Farm Omiyi James. He has been here dissecting issues of patient safety. He has done well justice to this topic today. And thank you so much for being on the show. We do hope that people will start adhering to doctors' instructions, pharmacists' instruction, take your medication at the due time, and of course take the amount you're supposed to take at that time. And of course, know that health is wealth. Keep your environment clean. Wash your hands. How often do people wash their hands? It's another thing entirely. Sometimes you even see children, people having newborn babies. People just come from nowhere and start touching the baby, carry the baby, kissing the baby, touching the baby. And it's me. I can't stand it. But what can we do? We live in a country where, you know, that saying that disease not a kill African man. But on a serious note, we need to take care of our health, because health is wealth. You need to, sometimes when you take these preventive measures, they can just help you to live longer. That would be a good place to wrap up the show today. But before we go, don't forget our Nigerian Week London that is fast approaching. All you have to do is to go to evabright.com and get your tickets to be part of that event. We'll have ministries, agencies, parastatals, and of course, film producers, musicians, fashion icon individuals already partnering with us. Everybody's shutting down London for that event. Do well to be part of that event. Don't be left out. We're going to showcase us as a people, our heritage, our style, our colors, our food, our film, our music, and of course, business opportunity. And while you are out there, also don't forget to hit on the notification bell, like, share, invite somebody to the page, and also leave us with your comments. We'd love to hear from you. And while you're out there, stay safe, be at alert. Remember also that peace is priceless, so let's give peace a chance. See you again next week as bring you our health. I remain yours truly, Princess KESSY. Bye.
Hooray! It's Nigeria Week London 2023. This is a celebration of Nigerian foods, film, arts, culture, fashion, music, dance, and comedy. Also, there will be a comprehensive economic summit, exhibition of Nigerian organic agricultural produce,